I'm Anne Arundel County Executive Stuart Pittman, and I'm here at the Anne Arundel County Fire Department headquarters. And we're here to talk about health and wellness today, which is really what I believe and I've always said is the real measure of whether local government is effective, is whether we can take care of our people, especially our most vulnerable people. And we have data today on a new program that I don't know if it's being done anywhere else, but it's called Mobile Integrated Community Health. We call it MITCH for short. MITCH comes to the rescue. And I was brought this program for our FY21 budget. It started in FY20, and we were asked to fund some positions in the fire department, fund some positions in the Department of Aging and Disability, and it's working. So what it is that we have a lot of people who are in the emergency rooms of our hospitals way too often. They're calling for things that are repetitive, that aren't necessarily major medical issues, but they just don't have anybody else to call. And that fills up our emergency rooms and makes it harder for the rest of our residents to get in when they need to get in. And so our hospitals got together with our health people and our Department of Aging Disabilities and our fire department and said, we've got to figure out a way to serve these residents so they're not having to call. And so we have had, since the program started, 317 referrals, and of those, 203 are in regular case management now. So these people are approached and they're asked how we can help as county government, and then the team goes in there and they identify where. We've got some team members here. They go in and they ask what the problems are. Why are you having to go to the emergency room so often? Why are you calling, our emergency medical personnel so often? And often they're finding that it's something very simple that can be fixed, and they're connecting them with other services. So we're going to hear more about how that works. But I do want to say that since it started, for those 203 people, there has been a 70% decline in their calls for emergency services. So that's going for those 200 people from 1,115 calls to 335 calls. So that's 780 calls that we don't have to make, which is a savings to Anne Arundel County. And then, as you can imagine, the savings to Baltimore Washington Medical Center and Anne Arundel Medical Center Luminous are even bigger than that because they don't have them coming into the emergency room. So we have a $1.44 million savings to Anne Arundel Medical Center, we're told, and a $3.4 million savings to BWMC. You'll hear about how that's all calculated. But I want to bring up the people who are actually doing the program, who can tell you how it works and how we measure the performance metrics. So first, we have Chief Wolford, Fire Chief, Anne Arundel County.
Thank you, sir. Greetings, everyone. Thank you for joining us. This has been an incredible program. We started this program in a pilot version a couple years ago. And really what we noticed is a lot of our clinicians in the field who are on our transport units were saying, boy, we're seeing the same patients over and over, and we just feel like we're not helping. And we thought to ourselves, what can we possibly be doing better? And this is a national conversation that thankfully we are lucky enough to play a part in here locally. And the conversation turns to how do we do more for some of these individuals who need more? The Mobile Integrated Community Health Program is about a quality of life. And that's what we always try to do for our residents, is how do we give them the best quality of life so they can actually live their life the way they want to live it. Nobody goes to a hospital anticipating they're going to be back in 2 weeks, a month, 3 weeks. They go to a hospital hoping we can mitigate their emergency and we can make them feel better, and they can go on with life, whether that's being with their grandkids or going back to work. And so this program is really about the right care at the right time, at the right place for what their needs are. It's very individualized. We have a phenomenal team of 4 of our providers that work together, and this is in conjunction with the Department of Aging. And we always stress that sometimes what they need is not necessarily a medical intervention. It's that they need a social service and they need something else that will really help them get to where they want to be in life. So on behalf of the fire department, to the director of the Department of Aging, to our partners in the hospital systems, Anne Arundel Medical Center, BWMC, Baltimore Washington Medical Center, this is truly a community partnership that has made this team successful. So we look forward to taking care of more individuals and hopefully expanding this program so we can help more of the community. Thank you.
Good afternoon. My name is Carissa Kelly, Director of the Department of Aging and Disabilities for Anne Arundel County. I'd like to thank the County Executive, Stuart Pittman, for his unwavering support of innovation in government. Thank you, Chief Wolford, and in the Fire Department for an amazing partnership. Thank you to both the University of Maryland, Baltimore, Washington Medical Center and Luminous Health Anne Arundel Medical Center for your support and excellence in population health. I'd also like to thank the MIC team members from my department, Joelle Ridgway, Allegra Bass, Caitlin Esklund, and Rebecca Lindenberger. So the MIC program began as an effort to reduce high utilization of systems of care such as 911 and hospital care for non-emergent needs by wrapping resources around the individual with the goal of self-determination and community independence. The MIC team of paramedics, a nurse case manager, and a social worker work to proactively address medical and social determinants of health. Through services such as medication reconciliation, placement of adaptive equipment for mobility, assistive technology for communication, health promotion education, and resource navigation, the MIC team coordinates an individualized plan of support and care. I would like now to introduce a great partner, Dr. John Wendell, Medical Director.
Good morning. My name is John Wendell. I'm the Medical Director for Anne Arundel County Fire Department, and as such, I get to oversee the medical aspects of our mobile integrated health program. Emergency medical services is nothing less than the practice of pre-hospital medicine. We know that every day our EMS clinicians respond in the field to medical emergencies, but not every call to 911 is a medical emergency. Sometimes patients just need help with their ongoing chronic health symptoms like chronic health failure or congestive heart failure or asthma. Sometimes they're just lonely and they need somebody to talk to. What our mobile integrated health team does is gets together and looks at all of the social determinants of health and comes up with an individualized plan for that specific patient. And our program is working. So we know our program's working for our hospital partners as it's providing a significant amount of cost savings. We know the program is working for our fire department. As the county executive said, we have significantly decreased 911 utilization for those enrolled in our program. Of the 203 patients that are enrolled in our program, they had 1,115 calls to 911. Since enrollment in that program, of those 203 clients, we've decreased those calls to 335. So a 780 call savings. That's a significant decrease in the number of big trucks running lights and sirens down the road. It's a significant decrease in late night wake-ups for our firefighters who are working long shifts. And it is a significant decrease in emergency department bed utilization. And most importantly, this program is working for our patients. It's very successful for our patients because it's rather than a you call, we haul type of system, we can get together with our clinically integrated team and come up with an individualized plan for those clients, serving their needs and in turn serving the needs of the greater community. This program has had a lot of champions and it's hard to get a program like this off the ground. I do want to take a moment to personally thank some of the people who are heavily involved in the development of this program, from the Fire Department Battalion Chiefs Rob Vaccaro and Joseph Sabak, paramedics Kevin Turner and Chris Chase, paramedic Lieutenant Jeff Pecor, from the Department of Aging and Disability, licensed social workers Katie Esklund, Allegra Bass, and Joelle Ridgway, and as well as our registered nurse, Rebecca Lindberger. And of course, without the vision of our fire chief, Tricia Wolford, something like this never would have gone forward. So in short, this is an amazing program. Thank you all for supporting it, and we'll continue to do everything we can to support the citizens of Anne Arundel County. I'm proud to be part of this county, this department, and this program. Thank you.
All right, good morning, and thank you to the county executive and others for his support and for providing us the opportunity to discuss this important program today. My name is Neil Vebacher. I'm the Chief Medical Officer at the University of Maryland, Baltimore, Washington Medical Center. Our hospital, as you know, has one of the busier emergency departments in the state of Maryland, and many of our patients need additional support before and after their visit to us. While we at the hospital have services in place to connect patients with social, financial, and health resources, the Mobile Integrated Health Program allows patients to be connected to similar resources while still in the community. One of the key components of the Mobile Integrated Health Program is the identification of high-risk community members, either based on past utilization or through referrals from our hospitals. Once identified, they have the opportunity to receive one-on-one in-home health from a nurse, paramedic, and social worker. And just as Chief Wolford had said, ensuring that they are receiving the right care at the right place at the right time. Most importantly, the program ensures patients receive education and resources to better care for themselves now and into the future. Public-private partnerships such as this are vital to improving the quality of life for many across this county. Thank you to the Anne Arundel County Fire Department, EMS, Department of Aging, and Anne Arundel Medical Center for your partnership and dedication to the residents of Anne Arundel County. We look forward to more opportunities to collaborate such as this.
Good morning. I'm Jen Harrington. I'm the Chief Operating Officer for Luminous Health Anne Arundel Medical Center, and appreciate the opportunity to share with all of you the successes of the Mobile Integrated Community Health Program, also known as MIC. I know our President, Sherry Perkins, would have liked to be here today, as she's been a huge supporter of the program since its inception in February of 2020, and certainly sees the tremendous value this has for our communities. This program supports what is known as the triple aim in healthcare, and the triple aim really focuses on new designs that incorporate three core components, and that's improving the patient experience of care, improving the population or the health of populations, and reducing overall healthcare costs. Therefore, you could summarize that as better care, better health at lower cost. And this program that really enhances the emergency medical services for the citizens of Anne Arundel County really focuses on what was talked about before, the right care at the right time at the right place. So MIC bringing community-based paramedics along with nurses and social workers supported by the Department of Aging and Disabilities into the home of the county residents, and allowing them to assess their healthcare needs and really coordinate their care allows for the reduction in the overutilization of 911 and our use of our really busy emergency departments at this time. So the real focus is appropriate level of care. So we can't express enough the value that this program brings, not only in reducing healthcare costs, but really promoting access, addressing those social determinants of health, and really improving health outcomes for our citizens. So to date, Anne Arundel has contributed $200,000 to this program that has supported several hundred residents. And in addition, MIC also helps support our remote patient monitoring programs for patients that were discharged post-COVID diagnosis from our hospitals with home visits, and also helping with vaccinations of homebound vulnerable adults. And before I close, I'll reiterate the gratefulness for partnerships. It's really programs like this that really emphasize how we can collectively work together to improve the health of our citizens. Thank you very much.
So as we were talking before I came in, the chief warned me that part of the purpose of this was probably to convince me that when she comes in with her budget request for next year, that this program probably should expand, and it will cost more. In fact, it was closer to 300, and then I think we might have bought a truck along the way, but there's no question that a program like this saves money in the long run, and so you're going to be seeing more of it here in Anne Arundel, and I think you'll be seeing more of it elsewhere as well. Some of you are probably here because the CDC is going to be hopefully approving vaccinations, COVID vaccinations for children 5 to 11, and that will happen either Wednesday or Thursday, we're told. And as always, the Anne Arundel County Department of Health is a step ahead of the curve and prepared with a plan and they've been working on this for weeks. And so I'm going to ask Dr. Kelly to come up, and our health officer, and tell you how people are going to be able to sign up. There aren't going to be as many vaccines in the beginning as we would like. We have, I believe, 51,000 kids age 5 to 12 in the county, and we won't have enough doses for everybody in that first week, but we're going to hear what we will have and how we're going to get it out. So come on up.
Thank you, County Executive. I'm Dr. Nilesh Kalyanaraman, the Health Officer for Anne Arundel County. And I do want to talk a good bit about the vaccine, the COVID vaccine for 5 to 11-year-olds. On Friday, the FDA approved the emergency use authorization for the Pfizer COVID vaccine for 5 to 11-year-olds. They found that the vaccine was safe and effective in this age group. This is the same Pfizer vaccine that those 12 and older have been getting, and it will be 2 shots 3 weeks apart. The only difference is that the dose for 5 to 11-year-olds is 1/3 the regular dose. So I've reviewed the data, and it's impressive, with over 90% effectiveness in preventing COVID cases in the vaccinated versus the unvaccinated. The vaccine also produces an immune response in 5 to 11-year-olds that was the same as that produced in 16 to 25-year-olds. And the safety profile is very good and is no different than what we've seen for those 12 and older. Of course, the CDC will continue to collect safety data as children get vaccinated to make sure that if any safety issues arise, they can detect them. The CDC will be meeting today and tomorrow, and we anticipate that they will make their recommendations on the Pfizer COVID vaccine at some point tomorrow. All providers have to wait until the CDC makes its formal recommendation before we can start administering the vaccine. Now, the vaccine for children comes in its own vials and packaging. Providers can't use the adult vaccine vials for children, and that's a safety measure to ensure that children get the correct dosage. In Anne Arundel, there are over 10 pediatric practices and over 30 pharmacy locations where you can get the COVID vaccine for children. Each of those locations will get their vaccine dose at different times over the next few days to weeks. And we'll share which pharmacies will have that vaccine. We'll also leave it to each pediatric practice to communicate with their patients on whether they will be vaccinating 5 to 11-year-olds and how they plan to do it. We've been working with pediatric practices for many months now to support them in their vaccination efforts by providing technical assistance, supplies, and vaccine as needed. At the health department, we expect our first shipment to arrive in the middle of this week. The state's electronic record for vaccines is scheduled to be updated after CDC approval, likely sometime Thursday. We will post appointments only after the CDC makes its recommendation. Appointments are going to be released at 2 separate times to ensure that everyone has a chance to sign up for a vaccine. We'll also make appointments available via phone and through our health ambassadors. The exact times that appointments will be released will be shared either Wednesday evening or Thursday morning and is dependent on the timing of the CDC's announcement. Given this, we'll begin our first vaccination clinics for children 5 to 11 starting this Friday. For the week of November 8th, we'll have children's COVID vaccine available at multiple locations throughout the county, including Pitt Moyer in Annapolis, Anne Arundel Community College in Arnold, and Bay Meadow and Glen Burnie. In addition, we're also partnering with the Anne Arundel County Public School System to vaccinate in 2 elementary schools 6 days a week for 2 weeks, starting November 8th. This is a total of 24 elementary schools, and it'll allow us to vaccinate throughout the county. It's how we can make it easy for parents to get their kids vaccinated and do it in a comfortable space in schools. We anticipate that it'll take 3 to 4 weeks for vaccine supplies to match the demand. This means that there will be a wait for the first few weeks to get your child vaccinated, but rest assured we will vaccinate your children. At the health department, initially all appointments will be appointment only, and we will not be taking walk-ins because of this limited supply. We also ask that one parent or guardian attend the appointment per child. The Pfizer COVID vaccine is free, it's safe, and it's effective. While children do have lower rates of severe COVID, including hospitalization and death, they still can and are affected by COVID, and we've seen children hospitalized in our county and throughout the country. This vaccine will keep our kids safe and healthy and is the next step on our path out of this pandemic. And on a personal note, I have 2 children, 9 and 11 years old. And after reviewing the data on effectiveness and safety, I'll be getting my children vaccinated as soon as we can get an appointment as well. I encourage all of you to do the same. Thank you.
So, I'm sure there will be questions on that. Before we jump into questions on both of these programs, I just want to quickly thank the Anne Arundel County Council last night. They passed a number of very good bills, all 7-0, bipartisan votes. We strengthened the penalties for illegally clearing trees, a practice that some developers have found is the most cost-effective way for them to get through the permitting process, which we don't like. We extended the public safety officer tax credit. We extended outdoor dining in tents in Anne Arundel County through January of 2023. Signed that bill at Fat Boys Crab Shack last night when it came out of the copy machine. And we agreed to a lease for the Severn Intergenerational Center with the Boys and Girls Club, a huge project that many of us have been working on. There'll be a groundbreaking in November, in about 10 days. And finally, we passed the booze at bingo bill. You can drink when you play bingo in Anne Arundel County as soon as this bill is signed. So, any questions for any of us?
Yeah, you spoke about a limited supply of vaccines. How limited are we talking?
Complicated question.
So we have about 51,000 children 5 to 11 in the county, and we will, in the first week or so, between the pharmacies, pediatricians, and health department, we'll have enough doses for about 25% of kids, just enough first bolus. That's first doses. And then we should be getting more as the weeks roll out.
For the first batch of kids that will get vaccinated, is there going to be some sort of priority status given to those with, say, underlying health conditions, those who are at most highest risk for this?
So that is something that we talked about. That's why we need pediatric practices. They know their patients who have those conditions in the hospitals as well, and that's the population that they're going to need to focus on.
And how long do you think it's going to take should parents choose to get their kids vaccinated, how long will it take to get all 51,000 vaccinated?
You know, we could realistically get every child at least their first dose within the next couple of months, as long as we get supply, and that's really the main limitation.
Dr. K, do you have any indication how many of those 51,000 are intending to get vaccinated based on maybe the older age group?
Yeah, so what we've seen from surveys which amongst parents which is very similar to what we saw amongst adults at the end of last year, was that it's about a third who are ready to go right now, get their kids vaccinated, about a third who are waiting and seeing, and then about a third who say no. And what we found over time, over the first few months of this year, is that those numbers shifted. As more people got vaccinated, others saw, okay, this is a good thing. And so we saw those numbers shift. So that's what we expect for this round.
Dr. K, you talked about uptake among parents of the younger kids. What about pediatric practices? And can you explain, of the shipment you're anticipating this week, of maybe 12,000 or so doses, how many are going to you, the health department, and how many will be divided up among the pharmacies and the pediatric practices?
Sure. So we'll be getting at the health department. We'll be getting just a little under 5,000 first doses.
Oh, this week.
In the next few days, yes. Okay. Over the next few days, the pediatric practices should be getting about, I want to say about 2,500 first doses, and then for the pharmacy sites, they'll be getting about 5,000 first doses.
Okay. And so, and what about? Have you had any trouble? Have you had to recruit pediatricians' practices or recruit pharmacy locations to get on board?
So the pharmacies have been doing this for quite a while, so they've been ready to go on that. We've been working with pediatricians' offices for many months, really focused on that 12 to 18-year-old age group, but also very much with an eye towards the 5 to 11. We know that particularly at that younger part of that age range, 5-6-year-olds, there's going to be greater comfort in a pediatrician's office. And so we've definitely been providing, as I said, technical assistance, vaccines, at least earlier in this phase, and any other supplies or support they need.
Are these doses being sent directly to the pediatricians and the pharmacies, or are they being funneled through the health department?
Currently, the vast majority of those doses are going directly to the pediatricians and the pharmacies, because there's a minimum number of doses that needs to be accepted. For practices that want smaller amounts, maybe 10, 20, 30 doses, we can certainly provide that to those practices.
Dr. K, where's the first clinic? I'm asking the same question some other counties have revealed already. Where's the first clinic going to be this Friday, and how many appointments do you hope to make available to the public?
So we're not sharing the exact location this time, just because we're trying to finalize everything based on supply. We know it'll be one of our fixed sites. And we have multiple sites that are obviously in operation already: Pitt Moyer, Anne Arundel Community College, and Bay Meadow. The first few days we'll have a few hundred doses, and as I mentioned, those approximately 5,000 plus first doses will go out over the course of the next 2 weeks.
And that's all going to be on your website, or is it there now?
Nope, that will be posted on our website once that CDC approval goes through.
Will it? A few hundred appointments for the first few days. Would it be kind of like what we saw opening large vaccination sites, where it kind of, you had to figure out the flow and the process in the first few days and then ramp it up, or will it be different for kids?
This is going to be a bit different. Our goal is to have a lot of small sites, which is why we're really focusing on the strategy of using elementary schools to provide vaccinations. If you'll recall, we funneled a lot of doses for adults through our large sites, our 3 or 4 large sites. In this instance, we'll have a few large sites, but we'll be pushing the bulk of them through the elementary school process.
Time for one more question, folks.
How many elementary schools was it again?
24 in the first 2 weeks.
Oh, okay, I want to ask.
I have a question for the county executive. You talked about a number of bills passed unanimously last night. Can you provide an updated timeline on the pay raise for bus drivers?
Yeah, we'll have an announcement about that soon, exactly what we're going to do and how we're going to do it, but not yet.
Okay.
Yeah.
Any last words about you started by saying you measure how you're doing by the health of the community. What do you think about the plan for getting these shots to kids? How do you think you're stacking up there?
Yeah, I mean, I think what you're hearing is that we don't want to announce before the confirmation from the CDC comes out exactly where to go. We don't want people to line up. People are going to be impatient. That's what happened before, and we're making a point of being very careful about where we put out the information, when we put it out, after the announcement is made. And also making sure that the doses don't all go to the people who are the most connected digitally, who have the time off from work to sit by their computers. It was like that before, and so that's why we have an equity plan for this as well, where some of these doses will be held to go to some organizations that are in the community that can get to communities that don't get served as quickly. So it is always frustrating when there are not enough to go around, and there are going to be a lot of families who are going to be in a big hurry to get this done, and I'm glad that they are. It means that people really want this and want to get their kids vaccinated. So but it's going to take a couple months to get everybody vaccinated. So bear with us.
Thank you.
Yeah.
Thank you.